Make host. Okay. Yes.
Host.
कर दिया. Thank you.
Thank you, Dr.
Okay,
Balachandran,
okay.
Dr. Deepamala.
What is it?
Good evening, good afternoon, and good morning. This is the 1588th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. VRUSHALI Saraswat. Let us begin the session with 1 minute silent prayer. Thank you all, lovers, students, and doctors. And we have 3 sessions every day. The first session of the day in Hindi is already over from 7:30 to 8:30. And from 8:30 to 9:30, the international session in English. And from 9:30 to 10:30, we have in a local language session in Malayalam. All these sessions are going in a good way, and we are uploading the videos of the same on the very next day itself so that you can watch it without paying a penny, and you may subscribe the videos and share it with your friends so that homeopathy will reach every corner of every corner in the world. And this is what purpose of International Forum for Promoting Homeopathy. So let me come to today's guest. As you all know, today our guest is Dr. VRUSHALI Saraswat, and a doctor by profession and healer by choice. That is her profile all about. And she is an international speaker, teacher, and a happiness coach, and founding member of Homeopathic Journal India Foundation, a recipient of many awards, the International Inspirational Woman Award in 2021, India Professional Award in 2020, Savitri Gauri Puraskar in 2019, and presentation of more than 35 webinars at international forums, and presented various papers at national and international journal, as well as she has paid presentation in various seminars also. Undertook many public awareness classes to promote homeopathy among public, as well as motivate doctors, junior doctors also. So today, Doctor will be discussing about the importance of dreams in homeopathy. As you all know, dreams is a big thing, but they need to be explained in a good way, and a physician who can describe the same in a good way can choose the right remedy to save the patient in the shortest possible time. So we proudly welcome the guest of the day, Dr. VRUSHALI Saraswat, to this session. Welcome, madam.
Thank you. Thank you so much, Dr. Danesh, and all the homeopaths from across the globe. It is such a pleasure that you guys are continuing this work, and it's a humongous task, I think, putting speakers together and managing all the topics. It's really, really appreciable, and I really want to thank you all for inviting me yet again. I have given a similar talk on dreams last month, and that was in Hindi. And Dr. Sahani said that please do the same thing again in English. So doing the same thing doesn't have the same fun. So I've added few cases, and I have, you've made me host, is it?
Yes,
I'm
yes.
getting, okay, okay. All right.
Okay.
So, dreams is one such topic which is one of my most favorite aspect in case taking, and now I have got a reputation that when patients refer another patient, they say, do one thing, first 15 days you maintain a dream diary, and then only you go to Dr. VRUSHALI. That has become my reputation now. So anybody who comes to me comes with proper dreams now. So, in so many years, I have asked, so what is the earliest age you can think of where patients can tell me dreams? Any idea? Any thoughts on that?
Uh, at any time after 1 year or so, even before that also, sometimes children may react to the situation, and we can
Right,
see child is laughing and like that.
right. Right. So, it is true. Even youngest possible children can also dream, and they do dream. They definitely dream. Whether parents are vigilant enough, whether parents are able to narrate those dreams in accuracy, or the parents are believing the child, whether he's saying the dream properly or not. Because that is one thing wherein, when I ask dreams to children, parents will usually say wo kuch bhi bolega, that child will say anything, so don't focus on that, you just listen to us. So that's the time when I say ask parents to move out, and I define the case with the child. So it becomes extremely useful, and you will see how it becomes useful. So I'll start sharing my cases. And because somebody shared that I should manage my time better. So what I've done is I have rearranged my whole presentation. So don't mind the numbering on the cases, okay? There are so many cases on this presentation. So a little about myself, if I have to say why I started studying dreams more, is because I am into so I'll just stop it for 2 minutes, and I can share a little that I am into holistic homeopathic practice for last 25 years now. And I have trained a lot of homeopaths. I have conducted a lot of webinars, so more than 100 now. But in all of that, interacting with people, what I realized is homeopaths struggle the most in finding a personality type, in identifying as to where exactly they have to, root their feet and into the case, and how do I come to a remedy. So, are there any sure shot ways? So, those were the questions which homeopathic students have always asked. And to answer them, I started figuring out case taking in a different way, and where we can find out exact remedy which is not having the color of our interpretation, and not even having a color of the patient's interpretation. Because a lot of times patients come up with their own idea of themselves, which may or may not be the truth, and which may or may not lead you to the right remedy. So that's where I started dealing with dreams, and that's where I started understanding it way more. How I will talk about it little more. But from 2010, typically what happened is my practice began more around the mental symptoms, more around psychiatric cases, more into counseling I got into. And the more I started understanding mind, I understood it very well that dreams are a sure shot thing which will help me understand a person irrespective of anything. So let's start with cases. Sir, my screen is visible to you all?
Yes, yes.
Yeah, perfect. So I'll go full screen. And so a couple of things, like for my fellowship, I have given a dissertation on dreams. When I did my PG Homeopathy London, I got a gold medal for my dissertation on ADHD, wherein I have incorporated dreams as the most powerful tool. Okay, so a couple of cases I will be sharing from those dissertations as well. So this was a case of a 27-year-old boy having panic disorder. So he was a very smart, very good looking person, but he had a lot of complex about how he is perceived by other people. And there was so much data. He himself is a homeo enthusiast, and his grandfather was a homeopathic practitioner. So he was a homeopath by not by education, like he was not a medical doctor, but he was practicing homeopathy. So this guy has already taken homeopathic medicines lots and lots of homeopathic medicines. So you can understand so much mess he had come with, and there were a lot of complexities, lot of family dynamics. So too much story. So how do you come to a conclusion? So that's where I asked him about his dreams. And very interestingly, he gave dreams of being comical. So what do you exactly mean by dreams comical? That he felt as if sometimes he is a joker, sometimes he is standing as a stand-up comedian, sometimes he is sharing, entertaining people, and people are laughing. So that is what dreams comical meant. So there were multiple dreams. So all the themes I had taken. Then he also had dreams of conspiracies, that his parents were divorced, so he thought that his father's side is building up conspiracies against him, and he kept on dreaming about it. All his dreams would continue even after waking. This was very, very interesting, because he said, even when I wake up, my whole mind goes on and I am inside the dream. I cannot step out very fast. He would dream of drunken people. So his father was a drunkard, and that's why the parents got divorced. However, he did feel he also kept on dreaming of drunken people. Then he had clairvoyant dreams, and in that also drunkenness during. So whenever he would drink, then he would have clairvoyant dreams. And he, sometimes, just because he used to be so anxious, he had panic disorders, right? So he would be very anxious to know a few things. So that's why he would drink and then go to sleep, and he would have clairvoyant dreams. Then there were exhausting dreams, because he used to get very tired with it. There were pleasant dreams, they were vivid. He would describe dreams like crazy. When I put all these dreams into repertory, so my favorite repertory is Murphy, by the way. Okay, when I put all of it into the repertory, the chart gives me a remedy which has very it gave me a complete inroad into the case, wherein I could enter with much more clarity, because I had already told you there was so much data which was kind of making me paralyzed. I was not able to identify any remedy. I was not able to go closer to that. But when the dreams gave it, it was very clear. There was not a single remedy which was covering all the dreams except lachesis. And I started with lachesis, and definitely this was just the entry. Then there were other psychodynamics things which coincided with it, and I could, find a simillimum very, very easily. And just within 3 months, this guy became completely symptom free. He still has anxiety. So I have been treating him. I treated him for almost 1.5 years after this. So total 18 months, or maybe more than that, 21 months I have treated him. And first 3 months he became symptom free. After that, there were so many complexes which I had to handle. But lachesis did the magic. Then comes another case wherein, this lady had dreams of accusations, and she used to go through a lot of physical abuse at home, and her husband was already betraying her, and there were again a lot of complications, lot of too much data. So I said, let me just take dreams. And the way I take dreams is, I tell them, you can tell me any dreams till today, right from your childhood. So it becomes very easy for them. Okay, so she had dreams of being accused. She had dreams in afternoon. Like, typically when she used to take a afternoon siesta. That time she would have dreams. There were amorous dreams. There were dreams of lot of anger, lot of crying. She used to sob during dreams. And typically in the afternoon, when she would have these anxious crying dreams, her daughter would observe it and she would wake her up. So that's why she knows ki she has these dreams of crying. Okay. And she also dreamt of being betrayed. There was cold sweat and all these dreams. When I repertorize, one remedy covered all. So there are a lot of other remedies like lachesis also came very close. There was staphysagria came, aurum came, but one remedy which ran through and through was natrum muriaticum. And her husband was deceiving her, so there was a genuine betrayal in her life, and she was not in a position to confront him. She was not able to leave him. So I was having a while I was taking the case, I was having a dilemma between lacunainum and natrum muriaticum. But when I go through dreams, only natrum muriaticum stands out. Lacunainum is nowhere in the picture. That just clarifies, because I was having lacunainum in my mind, because I thought that she's not leaving this husband, she's staying with him. But her reason was beyond that. It was not just because her husband is providing her, or she wants to stay back, just like a dog who gets abused and still stays. It was not like that, but because she felt that her responsibility towards her daughter and her parents is so much that she cannot allow them to see what kind of a sad life she is having. So that's why she stayed back. And then when this reasoning became clear, I could see that reasoning only through dreams. So that was such a beautiful case, and natrum muriaticum helped her immensely in managing her sleep. So she had typically come with insomnia, and there was a patch of vitiligo which went away in 8 months of treatment, and we still continued her counseling and all. Okay, so then there was this another case of a 28-year-old female. So she I'm going to run very fast through the cases. Okay, so I'm sharing are glimpses of the case and how dreams helped me. Okay, so 28-year-old female, she was working as a AD on a famous film set. Okay, with a very very famous film director. As an assistant director she was working, and she had changed multiple jobs before she landed this job. And because this was a very famous production house and a very famous director, so she didn't want to mess up, and that's why she came to me for treatment of her generalized anxiety disorder. She was very very good at her work, but she would have a lot of anxiety to be on the set, to be working at late working hours. And these film sets are usually on remote places and secluded places, so she would have a lot of anxiety with respect to that. And the entry point in this case was through dreams of rape. And she would dream that a man is pursuing her, a man is following her, just because he wants to rape her. And that was this dream has only 5 remedies in that. So it was so specific that she had mentioned. And when I included this dream with all her other features, CPS stood out. She had a lot of workaholic kind of tendency, and she used to find it very difficult to confront people, and she had like all those sepia mollusk kind of symptoms. But this particular dream gave me an entry into that case, and we could help her in 18 months with generalized anxiety disorder. And she continued working with this particular production house, and just a couple of months back her movie also released, and she sent me such a huge card saying that just because of your treatment we could sustain, and I could be a part of such a big production. So it was a very heartwarming case. But again, same lot of data and I could not get an entry into the case, this specific dream got me to the particular remedy and which worked. So in her case, because the simillimum was very close to the case, the similarity was very high. That's why I started with 1M and I continued with 1M for a very long time, like 8 to 9 months. 1M BD for 2 days. Weekly doses were repeated. Lot of doses she required because her anxiety used to keep on yo-yoing all the time, and it was up and down. But she did extremely well with CPR. Then there was this another case wherein so this is one of the most famous CA preparation coach in Mumbai, and she's a 42-year-old lady. She runs these classes, and all the CAs who come to her classes, it's 100% sure shot great result for all her students. And for so many years she has been practicing, she has maintained an excellent, like 100% result of her students. So anybody who's struggling with a lot of failures in CA, once that guy comes to her, it is a sure shot case for her. So she's very hardworking and very intense. Like she came with a seronegative RA rheumatoid arthritis with severe knee and ankle pain. Both knees and both ankles had severe pain in for last 4 years. She used to just keep popping NSAIDs and she would continue. She had headaches for last 8 years. But in spite of having these complaints, she has not taken a break even for a single day. So apart from the vacations which she has taken with her family, she has never missed a single class. And she was very high on motivation, very driven from inside, and she had a very pleasing personality to the outside world. Okay, so all her presentations, if you look at her YouTube channel and everything, you will feel, wow, what a lady, amazing. Like she has amazing communication skill. But that was her defense. That was her way of adapting, because she was very career oriented. She was very driven. She wanted to bring out a great impact in the entire CA community. She herself wanted to become a CA. She could never. And that's why she started this. That if I couldn't, and I'm so intelligent, I want to see that my intelligence is used to creating more CAs in India. So she came with this very compulsive kind of a story on outside, but inside it was all chaos, because there were a lot of complication, lot of childhood traumas, and was also a very long, very big case. So I asked her about dreams. Okay, and you can understand that there is so much compulsion on doing good, and that was her psychodynamic space of rheumatoid arthritis. Okay, so she had dreams of being astray, going astray. So she would feel as if something is going to go wrong, and I don't know where I'm going. I am lost. I am confused. That was the kind of dreams she would have. She would have, like, while she's having dreams, she would feel she is awake. And this was very prominent. So you can see that in this case, we have 3 rubrics which are single remedy rubric. Okay, so she had dreams of driving out of bed. So suddenly she has to wake up and she would step out of the bed. Then she had dreams of disfigured body. She had dreams wherein she is being chased and she had to run backwards. This was one outstanding dreams. Okay, and I'm going to stop share and ask you, anybody has seen this particular dream in practice? Can we use the chat? Anyone? Because this particular dream is a very prominent dream. Dreams of being chased, like somebody is chasing you, but you are facing the person and you are running backwards. because I have a story to share here. So this first time when I used this dream was when my son was 3 years old, and he had a bubble bubble gun in his hands. Okay, and he used to spray that bubble gun, and he would walk backwards. He would spray the bubble gun and he would walk backwards. And I asked him, "What are you doing?" So he said, Mama, I am CPR. I'm doing this and I'm running backwards. So I'm squirting ink. So he had that bubble gun, which was squirting bubbles, and he was running backwards. And that just hit me that sepia, the mollusk, squirts ink and then goes behind. It faces, because anybody who wants to eat that particular mollusk, that fish is usually big. That fish, the mollusk cannot fight this particular fish, right? It's so small, tiny. So what's the defense mechanism of sepia? They will squirt ink, create a blurry vision, and they will run backwards. So that was such a beautiful thing which I learned from my son. So then I used it because one of my patient had shared this dream with me, that he always has a dream of running backwards. And he doesn't know what he is running from, but he is not running forwards, he is running backwards. And he had a wart on his thumb. That time I had given him sepia and it worked wonders. And again, in this particular case, in this lady's case, I found the same symptom. And there is only single one remedy in this dream. You can check any of the books, and you have sepia there. Sepia that did like magic in this case, and all her, the front which she was carrying of, a very brave front which she was having of performing career lady and all that, and the whole internal chaos, it became evident right from this dreams, all the dreams which she had. And then there were definitely other dreams, like, she would wake up, and then again, if she goes back to sleep, her dreams would continue and she would dream of her own family. Okay, so we gave her sepia. So far, so good. Are we okay? Are there any
Yes,
questions?
yes,
Yeah. Yeah. Are we on the right track?
yes, yes, yes.
Yeah. Do you guys want to know a little more about dreams, or you want to dive into the cases only? Or you want to understand? Because if I share my cases, it is just going to be my cases. You would not be able to identify it in your practice. So do you want me to share a few things as to what dreams actually mean and how you can apply it in your practice?
Yes,
Should I?
definitely,
Yeah.
definitely we
Okay.
need.
Yes. So I will share a few things, and then there are more cases which are there in my other talks on dreams as well. Okay. So I'm going to be sharing what dreams actually are, and why it is so important, and why I get so much success with, just looking at the dreams. Because that is one area, if you cannot find anything to create your own totality, you just look at the dreams and you will reach the remedy. It's that easy. So homeopathy is very, very easy, is my concept here. Okay, so let's go to the presentation and let us see what actually dreams are. Okay. Okay, so what happens is, when a case presents to us, we have to look at patient as a person. Then we have to look at physical complaints. Then we have to enter into the inner world of the patient. And as a homeopathic holistic physician, we also have to know the inner unknown world of the particular person. So we want to understand who this person is in all totality, from all the aspects. And how do you do that? Because, sometimes we will have like a lot of time, we will not have patients waiting, then we can give time to the patient. But sometimes when the waiting room is so full, we cannot give so much time. We cannot go into like every area into details, right? So that's where what comes into action is dreams. You can look at all of these aspects only if you focus on dreams, as I demonstrated already in some of my cases, wherein, the inner world, the inner exact world coincides with dreams. And there could be outer facade, there could be an outer different story which the patient would want to tell you. But the inner world will always be evident through dreams. So that's what dreams are, right? And let's skip about the fun facts. But why dreams are valuable? Okay, because they bypass compensation. So whatever defense mechanisms you have, your dreams are beyond that. Dreams lie outside of our ability to manipulate. Dreams is an attempt of self-healing. So anybody who has excessive thoughts, those thoughts will be converted into some beautiful dreams, and it's a way of healing himself or herself. Okay, and they are expressions of unconscious desire. It is something like offline memory reprocessing. So you're going to process all your memory, but when your eyes are shut, so you're kind of disconnected from the world, and the internal processing goes on. So most important is defense mechanisms, the compensations will stop the person from expressing his desires. For example, a child has dreams of murder. Now, the moment he says that, parents are going to shout at him. What are you talking? Do not speak like that. So, or a child expresses, "मैं मार डालूंगा तेरे को." And the same thing, adult can say that I have dreams of murder. I have dreamt that I did such thing. Even how much ever worse is that. It is very easy for us to share what the dream is or what we have seen in the dream, because how Carl Jung said that dreams were a hidden door to the innermost recesses of the psyche. Dreams are a door that opens into the cosmic night, which represented the psyche long before there was an ego consciousness. So this is too deep, but if we have to understand something which we do not want to tell even ourselves, we can share that as a part of the dream. For example, amorous dreams. Now, who is going to come and say that, my sexual desire is very high? But they can tell you, I get dreams like that. I have like other dreams I have. And then you ask them, do you have amorous dreams? And they will very easily say, yes, I do have dreams of having sex, or I seeing sex, or doing this or that. So, it becomes very easy. It is impersonal. Then you're not sharing exactly what your inner world is. So it could be a peaceful thing, or it could be a chaos inside. Whatever is your story, in the dream, you can share it. There is no qualms about it. You can very easily share what is happening inside, right? And it is only for the people who understand what dreams are, they will know. They will exactly grasp. So a person can come very well dressed and very well mannered and very well cultured and everything, but he can have very, very vindictive and very different kind of a personality inside. And all of that can be understood through dreams. Okay. So what in reality, what dreams are? They are preparation of future. They're processing of the past and their experiences of past, right? So all the experiences and processing are kind of propulsing you, kind of making you ready for your future. So therefore, dreams are extremely essential for the personality's time. Okay. And whenever we have frontal lobe is where the EEG activity is noted, and it induces reflective self-awareness. Okay. So what dreams do is what constitutes as dreams is something which has been seen by eyes. Okay. Now, this is very important from the homeopathic perspective, because a lot of times I have a couple of cases and I don't know how much time. Yeah, we do have time. So I will be sharing cases wherein I have taken inferences from what dream is not. And that has become perfect, exact remedy I've received from the description which the patient says. I do not get these dreams, because he is not going to say X, he's only saying Y. So you take whatever he's saying. So what will constitute as dream is something which has been seen by the eyes, something which has been heard by the ears. So you're sleeping, but you hear sound. So I have a case of hearing gunshots. Okay. Then there are experiences by other sense organs like tactile. There are cases wherein when girls are sexually molested and they have repressed, or it is in the family. So typically they are scared of sharing it, so they do not even share it with anyone. So typically those times there will be girls who will come and say that I have a dream, as if, so she will say, I do not see anything, but I have a feeling as if somebody is pressing on me, somebody is putting a lot of weight on me. And invariably I have seen probably some 40-50 cases wherein there is a history of molestation, some form of sexual molestation in that particular person's childhood. And it can be any other experience also. Touch is one, pain is another. So they will feel pain during, or they will feel complete paralysis, complete inability to move. That is also an experience, and that is also a part of the dream. You can find it in dreams. So typically, for repertories, we have to figure out what we can take where. So if you do not find it in delusions, go and find it in dreams. You will get your remedy. So dreams of desires, right? So that will also become what I want to have. That will also become a part of the dream. Dream is something which is imagined by the mind, right? So wakeful dreams, they will also become a part of the totality. And it can be an indicator of good, bad, whatever events they are taking place, right? So all of this will constitute as your dream totality. Okay. Now there are so many different theories of dreams. I'll not bore you with that. So yeah, I think I should Dr. Dhanesh, should I take few more cases, or we need to take, how much time do we have?
I think it's better to take another 5 minutes, then go to discussion.
5 minutes and then discussion. All right. So I'll try and finish two more cases in 5 minutes then.
Okay.
Okay. So so this was a beautiful case of just a 9-year-old child, and now he's probably 16 or so. But this was he had alopecia areata on various parts of his body. Okay. And because I'm practicing in Mumbai, so I'm blessed with a lot of great homeopaths in and around my area, like really, really big names. And this guy had gone to most of them. Okay. So when cases come from big homeopaths, it's already a lot of thought has been given. So you need to think too much. So constitutionally, I defined the case and I kept giving him natrum muriaticum, which was given by many other homeopaths, but there was no result. For 3 months, there is absolutely no result. Then that day, I just asked the child. Now I had developed a very good rapport. So I asked him, Ki, you sit and you tell me about yourself. You tell me about your dreams and things like that. So then he said, dreams of gunshots firing. Now you see, he's not seeing it. He's just hearing it. He says, there are gunshots somewhere and somebody is dying. there is a dream of death, dreams of gunshot firing. So I go searching and I asked him, what do you do? So he says, I'm hiding. शायद मुझे लगा है, maybe I'm her and I'm hiding. So it was very interesting. There was only one remedy in that. Mind, dreams, hiding, his wounds. Only one single remedy. And these single remedy rubrics are my most favorite ones. The day I get this rubric, I am sure that the case is going to get cured 100%. Why? Because these are the absolute sure rubrics, right? They're tried and tested. So then I put other dreams like dreams of death, dreams of gunfires, dreams of guns, rifles, shots, and dreams of shots. Whatever I could find in whichever repertory, I've just put everything together. And interestingly, to my surprise, I find this remedy, Hura. There was another, Mandragora was also there, and there were a couple of other remedies which were covering some dreams, but only one remedy was covering all dreams, and the only remedy covering hiding wounds during dream was Hura. And I gave him Hura, and in no time, he started having hair, and he had a full hair, like scalp full of hair in no time. And I think just 6 weeks or so, he had good amount of hair, and over 6-8 months, rest of the body also completely healed. You can see his neck still had patches of alopecia. There was like forearm and other back and everything healed very, very nicely. But it was dreams of hearing. So mind you, even any sense you see, any of the 5 senses, that is also constituting dreams. Okay, now let me take you. Okay, no, this is a long case. I'll not take this, and it's a rare remedy. Just give me a minute. I want to take some. Yes. So, what dream is not? How you can take this? So, I'll just take this one case. So, there was a very severe concentrated pain, which this very senior guy, he was 75 at that point of time, and he had severe concentrated pain from right hip to right knee in a straight line, and it was in the front, it's not in the back, so it was not a sciatica. Okay, and there was aggravation rest, there was aggravation sitting for long, and aggravation at night. And the way he explained is kasht hote hai, as if there's a lot of effort which I have to put in. Kasht. So, and he said he cannot sleep, and there is a very high intensity at night. Okay. So I asked him, I defined the case. So this is a very well-known person to me, some family relation. And I asked him, tell me your nature. Swabhav kaisa hai? And the way he says, it's very interesting. First thing what he says is, kiska sar thodi na tod sakte hai. That meaning, I can't break somebody's head, no. Now just there is no need for this sentence to come. And the second sentence, immediately what he says is, violence kabhi nahi hai mere andar. I do not have violence inside me. First sentence, I can't break somebody's head. Second sentence, violence is not there inside me. Very, very unique. Then he says, I think I'm a calm, satisfied person. I'm helpful by nature. It gives me satisfaction. And I do not have complaining nature. I do not have that in my nature. I do not complain. Okay. So then I ask him dreams. He says, I don't remember. Then I go on asking questions. Lot of questions I ask. He does not tell me anything. He cannot tell me any single dream. So then I say, you need to tell me dreams, because I have already been treating this guy for 6 weeks and there is no relief. He has already taken a lot of allopathic medicines and there is no relief. So then I said, now dreams is something which will definitely give me result, and I must do this. So I told him that you have to tell me something. So then he says, कभी कोई बुरे सपने नहीं आते. I never get any bad dreams. So then I ask him, what are bad dreams? So then he says, as if, किसी को मार डाला, काट डाला, खून कर दिया. As if I just hit somebody or cut somebody and murdered somebody. Now just think, where is it coming from? It's coming from his subconscious. Why did not he say that when bad dreams are there, why can't he say dreams of accidents, dreams of fire, dreams of robbery? All those are also bad dreams. Or, there could be anything which could be bad dream. But he says exactly these specific things. So I take it. Okay. And then he says, Sar phod diya, as if broken somebody's head. So, there were other dreams also of business, which he later told me. So, dreams autopsy seeing, dissecting dead bodies. Now, maar dala, kaat dala, and all those I could not find. So, then I found the nearest one. Okay. Then, dead bodies, dreams dissecting, dreams of sailing, unpleasant dreams, and dreams of water. When I put all these dreams together, along with all the other rubrics and everything, sanguinaria came. And that sanguinaria I can give so many references of sanguinaria now for this particular case. And very beautifully, in just 2 weeks, the entire pain subsided, which he was having for 1.5 years. That pain subsided and he could have a very peaceful sleep. Yeah. So this was so beautiful. Even if the patient is not telling you exact dreams, still you can identify a lot of things. Okay. So I can just go on sharing dreams in many aspects, many areas. But I would like to stop here and I would like to take some questions. Okay, so you can see there are so many cases which are there on the PPT. We can just go on and on.
Yes, Dr. Saraswat, it's really a beautiful session. You really explained how dreams occurs and what are the relevance of these dreams and how one can explain the dreams, and then one how can convert the same into rubric, and then after converting, then you get the single. If you get the single memory rubric, that will definitely work. That's why
Yes.
in those cases, sure that. Sepia works beautifully, and in this case also. So anyway, it's the time for discussion. Those who want to participate in discussion and want to have a question, you can raise your hand so that we will allow you to unmute yourself. Please raise your hand.
So, Vaishali ji has asked that what does it mean to dream of expansive waters, may it be rivers, seas, or wells repeatedly? So, a standalone dream of water will not mean much about the personality, but mostly dreams of water mean something that you're holding on to, and there are a lot of thoughts. So we need to identify what emotion you have along with that dream, and then we can take it forward. So it will always depend on other aspects of the case. We will never go stand alone by one single case, a single experience, single dream. Okay. So we will have to correlate it with many other things, but a lot of times suppression will be very prominent in dreams of water. A lot of time repression will also be prominent. So you need to explore the case in that regard. I hope this answers your question.
Definitely.
Yes.
Dr. Manoj is there. Yes,
Yes,
Dr.
Dr. Manoj.
Thank you. Nice presentation, really interesting one, and it often indicates or represents the personality of the patient. But there are some, we would not forget about the pitfalls in such cases. Often, because of some patients will say they have some dreams that they are not remembering
Yes.
what it is. Then another thing is that there are some exaggerations there. There may be some exaggerations. Then another thing is that the wrong interpretation from the part of the physician. Just you mentioned about this sepia. You are rightly
Correct.
interpreted, but some persons they may not able to interpret it rightly. So these are the pitfalls. So I think with an addition of if you add another physical general symptom along with this, definitely the medicine will be more correct, I think.
So, Dr. Manoj, you've pointed out absolutely correct. And that's exactly my point is that there should not be any interpretation of the dreams. Take it as it is. Do not interpret. So that's why I said, what does it mean is the question. That's why I answered. But that does not help us at all. It doesn't mean anything. What it means is inside of the patient. And we are not going to dissect it further. We will not add value to that content of the dream. But for me, as a homeopath, when I'm looking at it from homeopathic perspective, it just means a rubric. I'm going to be converting it into exact rubric, and I will take efforts to find out exactly what the rubric is. I will not be interpreting. So Dr. Sunil has also asked me that do you take up dreams as per Freudian's explanations? No, I do not. I'm a homeopath, hardcore homeopath. I will only convert it into a rubric. I will only find out what remedy is having this particular dream. I will not go on to interpretation of it.
Okay, then
If I
what about the potency and repetition and dietary
Yes. So
cases?
whenever I get these kind of rubrics which are having single remedy, which are having like a very higher correlation, so symptom similarity more, higher the frequency. Symptom similarity is less, and if there are interpretations, then I will not definitely take higher potencies. And I am not saying that this is the only thing in the case. Absolutely not. This is an entry. This is a sure shot entry. You are definitely going to analyze, you will have your own totality, and you will definitely match the whole picture with the patient. You cannot just take it, right? Single,
Okay,
one
thank you.
aspect will never be a part of the totality or
Okay, thank you.
prescribing totality.
So,
Right?
okay. Now Dr. Balachandran from
Yes,
Chennai.
Dr. Balchandran.
Dr. Vishali, am I audible?
Yes, sir.
Yes, you are.
Yeah, regarding the last case that you have discussed, the patient is not dreaming of anything.
Yeah.
But
Patient is not dreaming of anything, correct?
exactly. But he's saying instead that I'm not having a dream of cutting or breaking the head or something like that.
Yes.
But you have
Yes.
taken it in the interpretation of repertory, the dreams of cutting dead bodies or dissecting dead bodies. How does this match?
Correct. Correct. How does this come? So this is a case which which has been asked maximum questions, and I'm really grateful to you that you asked this. So I explained it even during the case that there are exact words and exact meaning which the patient is putting. I am not. I am not interpreting it at all. When I ask him, what dreams don't you get? What are the dreams you do not get? He said, when I ask him what dreams you get, he says, koi bure sapne nahi aate. I do not get a bad dream. So then I ask him, what do you mean by bad? So whatever he means is coming out of his subconscious. It is not coming out of, a lot of deliberation. Whatever came to him, fatafat, he's going on saying, that's why it is out of subconscious.
So why
It
don't we
is
take dreams pleasant?
dream. He
Which is
did
a bad
have he said dreams are not bad.
नहीं बुरे सपना नहीं है तो उसका डायरेक्ट इंटरप्रिटेशन क्या होगा then? Dreams
I
are
did
lucid
ask
only.
him. I did ask him. So then he told me that he was an ONGC employee, and all the dreams of being on the water or being on the what is that the site which they work on, those dreams were pleasant dreams, is what he told me. That he doesn't get it now, but earlier he would get those, and those dreams were pleasant.
So we can
So
take dreams of daily activities even, no?
so he was retired for last 20 years. He was 75 or so when he came to me. He was retired for 20 years, so he was referring to his old dreams. So as I told you, I take dreams right till childhood. It doesn't matter. It is still a part of personality. And it could be with any reason. So I do not interpret, I do not dissect the dreams. I take it as it is and find a simillimum in the repertory.
So the way I understand the case, it is like his inner desire of id is subconsciously letting him that you have to break the head, you have to dissect the bodies, you have to do these things.
So,
But
we did
his
not go
ego,
into detail of it, Dr. Balchandran, but that's a very beautiful case wherein the whole sanguinaria, the family is like that, the plant family, which is I'm forgetting the family.
that's okay, that's okay, you
Yeah,
understand.
but the theme is of violence
Huh.
and wanting peace. So his nature, the way he described, his violence kabhi nahi tha nature mein. I am a calm, satisfied person. That's what he wants to be, but he's not there. He
Okay.
has those kind of things in his mind.
Okay, thank you, ma'am. Thank you for
Yeah.
explanation.
So all these cases which I've shared, they are long cases. I do not do quick gun murgan nahi hai apne paas. We take lot of time, 1 hour ka cases, and then these are glimpses which I wanted to share with you all. So thank you so much for listening to me. Thank you.
Beautiful question and excellent answer. There was a beautiful discussion about that same case also. Anyway, there are people used to come to our clinic and after consultation, they may ask, doctor, I have such a dream. I am just drowning in water. Then what do you mean by that, doctor? Why whether I am going to die? What is your explanation that this, these are the things people used to ask to the counselors, and they used to give that, oh, your dream has such an explanation. You may die by suiciding or something like that. But as a homeopath, you pointed out it rightly that there is no need of going into that way. You just take the case, take the symptoms out of that, then convert it into the rubric, and then directly go to the medicine rather than go behind that. What is that and what is that? What will happen like that? If the patient is asking such question, then we can take the anxiety about his health or his future, like that. We can
Absolutely.
am I right?
Absolutely correct. And the whole purpose of doing this exercise of dreams is we should not be adding our color to the case. We
Yes,
should take it as it is without interpretations.
that is the lesson we got from this session. I think that's the best lesson you gave to the session, and it's the time to wind up the session. I invite Dr. Ram Paresha sir to say vote of thanks to the session.
Thank you, Dr. Dhanesh ji, or congratulations, Madam Dr. Virsalu, Madam. Congratulations. Very nice
Thank you.
presentation. Excellent session. Single rubric, only single rubrics. Dreams. Teach the patient. Very, very thanks. Behalf of IFPH, again presentation. Thank you, madam. And dreams, very good. Desires in mind. Desires mind. Dreams. So, very, very thanks, madam. Thank you.
Thank you so much. I want to express my gratitude to Dr. Dhanesh, Dr. Sahani, and Abdul Salam Bhai. These three have been persisting for such a long time for me to come and speak here. So thank you so much.
Thank you.
Thank you, Sri Abdul Salam sir, for your suggestion. So you can say a few words
Thank you,
also.
Dr. Vishali.
I've put down my email ID. If anybody has any questions, I'm very happy to answer them. Okay. Thank you so much.
Thank you, Dr. Shali. Thank you all for joining this session. And tomorrow we will have a session from Dr. Deepthi Sharma, BHMS, and she is an MD scholar. We'll be talking about PICA and its research-based homeopathic approach. With that, we come to the end of the day, 1588. Thank you all. Good night.